Okay, so we all have electronic medical records these days, right? But, like, have you ever actually stopped to think about who's in charge of all that information?
Right, because it's not as simple as just like typing it all up and calling it a day.
There's a whole system, right? A system to make sure those records are accurate and secure
Yeah.
and accessible.
And that's where EMR and EHR analysts come in.
EMR, EHR. Now, see, that sounds like a whole alphabet soup situation to me.
They're practically the architects of digital healthcare information. So they're the ones making sure that your history, your medical history, is accurate, readily available for any doctor, anywhere at any time to provide the best possible care.
So break it down for those of us who haven't donned the scrubs. What exactly is the difference between an EMR and EHR?
Oh, it's simpler than you think. Just imagine an EMR as your own personal health record at a specific practice. So think of it like a detailed diary
Okay.
of your visits, prescriptions, and everything in between.
Right.
Now, in EHR, on the other hand, that takes all those individual records and connects them
Oh, right.
across the entire healthcare system.
So if the EMR is like a single diary entry,
Exactly.
the
Yes.
EHR is the whole collection.
The whole collection spanning, your entire medical life.
Oh, wow.
Yeah. It's the difference between a snapshot, right, and then a panoramic view.
Okay, that makes a lot of sense. So where do these EMR analysts fit into all this? Are they like digital librarians for these medical diaries?
More like digital architects, actually. So they focus on optimizing the EMR systems, but within a single practice.
Okay.
And this could be anything from customizing software to, developing more efficient workflows,
Right.
but all with the goal of giving doctors and nurses more face-to-face time with patients.
So less time wrestling with computers and more time actually treating people. Yeah, I can see how that would be a real game changer in a busy practice. But how does that play out in like a real clinic setting? Give us an example.
Okay, so imagine a small clinic,
Mm-hmm.
and they want to implement this new medication tracking feature in their EMR system.
Right, yeah.
So the EMR analyst, they're responsible for making sure that integrates seamlessly. They customize it to that specific clinic's needs. They train everybody on how to use it properly.
So no more relying on patients to remember every single pill they've ever been prescribed.
Exactly. No more of that.
Yeah.
This system can flag potential drug interactions
Oh, wow.
or allergies in real time, leading to safer and more effective care.
That's incredible. So EMR analysts are really focused on, like you said, those individual practices. But EHR analysts, they're dealing with this massive network of information, right?
Right.
So what kind of challenges are they up against daily?
Oh, they're juggling a lot, that's for sure. They're the masterminds behind interoperability,
Okay, now there's a big word.
which basically means ensuring that these different healthcare systems can actually talk to each other.
Oh, okay.
It's like they're translating medical jargon into some kind of universal language that everyone can understand.
So they're like the UN translators of the medical world, except instead of different languages, it's like different computer systems.
Exactly. They make sure that if you have a lab result from one hospital, your family doctor can see it instantly, even if they're using a completely different system.
Oh, wow.
And it's all thanks to these data exchange standards like HL7 and FHIR. These standards, they're the unsung heroes of seamless data sharing.
Okay, so they're using these, let's call them like digital dictionaries to make sure everyone's speaking the same language. But how is this actually working in practice here in Canada?
Well, one really cool example is the Ontario Health Teams Initiative. This project is literally trying to connect the entire healthcare system across the province. So we're talking hospitals, clinics, community health organizations, you name it.
Wow.
EHR analysts, they're the ones on the ground weaving this complex web of interoperability.
So in a perfect world, a doctor in, say, Kenora could instantly access the medical records of a patient who was just treated in Toronto.
That's the vision, yeah. And it's not even just about convenience for doctors. This level of connection, of interconnectedness, can really improve patient care. We're talking about reducing duplicate testing, streamlining referrals, even tracking the spread of diseases more effectively.
Wow, this is starting to sound a lot less like a behind-the-scenes role and more like the foundation of the future of healthcare. But what about the Canadian context specifically? How do our regulations, our healthcare landscape, how do they play into all of this?
Yeah, no, you're absolutely right. It really is a game changer. And Canada, we have, well, a pretty unique healthcare system.
Right.
And that just kind of adds another layer of complexity, to the whole mix.
Okay, so how so? What makes the Canadian context different when it comes to like EMRs and EHRs?
Well, I mean, for starters, we have some pretty strict, privacy regulations here. EHR analysts, they have to be total experts in these laws, right?
Yeah.
Making sure every single project, dots all the I's and crosses all the T's. Those high standards for protecting your health information, yeah, they got to meet them.
Okay, so it's not just about making the technology work, it's about making sure it jives with our specific legal and ethical framework.
Precisely. It's a delicate balance for sure.
Yeah.
And then you've got organizations like Canada Health Infoway,
Okay.
which is a national organization. And they're like really championing like the digital health innovation,
Okay.
setting standards for data exchange, across the country.
So they're like the conductors of this massive, complex orchestra of healthcare data.
That's a great way to put it, yeah. They've been so instrumental in like funding and supporting these groundbreaking projects that are, pushing the boundaries of what we can even do with EHRs.
Speaking of groundbreaking, got any examples of these projects? I'd love to hear how this all translates into, real world impact.
Oh, yeah, absolutely. Let's take a trip to rural Alberta. Just imagine the challenges of trying to provide specialized medical care to people who are like spread out over these huge, vast distances.
Right. Yeah,
Right. So access to specialists is going to be limited,
for sure.
but that's where telehealth comes in.
Right.
And EHRs are like a really critical piece of the puzzle.
I see what you did there, connecting patients to specialists remotely,
Exactly.
which, I mean, logistically, that's got to be a challenge in itself, right?
Oh, it definitely is. EHR analysts, they've been working so hard to like integrate telehealth platforms with those existing EHR systems that they have in those remote regions.
So a doctor in a small town could be consulting with a specialist in Edmonton or Calgary without the patient needing to, travel all that way.
You got it. And what's even more impressive
Mhm.
is because those EHRs are integrated, that specialist, boom, they have instant access to the patient's whole medical history, lab results, previous diagnoses, you name it. It's all right there.
That's incredible. It's like bringing the specialist to the patient
Yeah.
virtually. It sounds like EHR analysts are breaking down geographical barriers in healthcare.
They really are. And it's not just happening in Alberta either. Let's hop over to BC. They're tackling a totally different challenge over there,
Yeah.
immunization records.
Okay, what's the story in BC?
So BC has this like centralized immunization registry,
Okay.
which is amazing. It's fantastic for tracking vaccinations across the whole province.
Right.
But for this to really work, right, that information needs to be easy to get to for all the healthcare providers,
Okay.
doctors, nurses, pharmacists, you name it.
Right. It wouldn't be very efficient if every single person had to track down that information every time someone needed a vaccine or couldn't remember if they had their shots or not.
Exactly. So EHR analysts, they've been working like really hard to link this central registry to the EHR systems that are used in hospitals and clinics all over BC.
Oh, wow.
So what that means is any healthcare provider, bam, they can instantly view the patient's complete vaccination record.
So it streamlines the process and makes sure that everyone stays up to date on their vaccinations.
That's amazing.
Yeah.
It's such a good example of how EHRs can impact public health on a huge, huge scale.
Absolutely. And it's not just about, treating illnesses. It's about preventing them from happening in the first place, right? And those are just two examples. I mean, EHR analysts across Canada, they're tackling such important projects. We're talking streamlining mental health care coordination, making those specialized treatment referrals more efficient.
It's really amazing to see how technology is being used to like solve these real-world problems in healthcare.
Yeah.
I have to admit, though, with all this talk about data sharing and everything,
Yeah.
it makes me think about security.
Yeah.
With all this sensitive information just like floating around out there, how do we know it's safe? How do we keep it safe?
That is the million-dollar question, isn't it?
It's something EHR analysts definitely take very seriously, though. They are the guardians of this information, constantly working to, fortify that security.
So what kind of safeguards are we talking about, specifically?
Imagine trying to break into Fort Knox,
Okay.
but instead of gold, it's your medical data. Okay? That's the level of security that they're going for here. We're talking sophisticated encryption.
Wow.
That makes that data basically, well, impossible to understand if you don't have the decryption key.
So even if someone did, like, manage to hack into the system,
Yeah.
they wouldn't be able to, like, make sense of anything.
Exactly. It would be like, trying to read a foreign language that you don't understand.
Right.
It's just gibberish,
Yeah.
unless you have the right tools to decode it.
Wow.
But it's not even just about keeping, those malicious actors out. EHR analysts, they play another really big role too. And this is in data migration projects.
Data migration, huh? What does that even mean? It sounds pretty intense.
Oh, it can be a massive, massive undertaking.
Hmm.
Imagine, like, a hospital system. They're upgrading to a brand new EHR system,
Okay.
or two hospitals are merging,
Right.
and they need to combine all their patient records.
Right, right.
That's what data migration is.
Wow.
Moving all that information from one system to another safely and accurately.
So they're basically like moving mountains and mountains of sensitive information without dropping a single file.
Exactly. It's
Yeah.
really meticulous work.
Yeah.
And EHR analysts, they're the ones who get it done. They map out every single piece of data, they clean it, they make sure it's accurate, and then they check it again to make sure it's been transferred correctly.
Wow.
It's a really important role to make sure that, patient care isn't interrupted during these transitions.
It sounds like they're like the unsung heroes of healthcare IT, working tirelessly behind the scenes to make sure that our privacy is protected and that all of our medical information is accurate and, where it's supposed to be.
They absolutely are. And their role is only becoming more and more important as
Hmm.
healthcare, keeps relying more and more on technology.
Right.
But this growing reliance, it does bring up some new questions,
Yeah.
some important
Like
ones.
what kind of questions should we be asking? I mean, it all sounds amazing so far, but I'm sure there are like some potential downsides, right? When you're dealing with sensitive information on this massive of a scale.
Yeah, for sure. I mean, the advancements that we're seeing in healthcare technology, they're super promising.
Yeah.
But we got to acknowledge the potential hiccups that come with handling so much sensitive information.
So, what are some of those hiccups? Like, what should we be keeping in mind as we're, going further down this digital healthcare road?
Well, data governance is a big one.
Okay.
We've talked about security, right?
Yeah.
And how they move the data.
Right.
But what about the rules, the processes?
Hmm.
How do we control how this information is actually used and who gets to see it? I mean, who should have access to our medical data and what are they using it for? Those are some pretty big questions.
Yeah, it's like we're basically writing the constitution for this whole new digital healthcare world. We got to make sure those guidelines and those safeguards are crystal clear.
Exactly. And then there's data integrity. How do we know that the information in these systems is right and up to date?
Right, because even a tiny error in a medical record could have huge consequences.
Absolutely. It's like that saying, garbage in, garbage out.
Right, right.
If the information's bad, the system's no good.
Exactly. Yeah.
EHR analysts, they're super important for maintaining that data integrity, keeping everything clean, but it takes constant work.
It sounds like a balancing act, really. You got to have the innovation, but you got to be responsible. So, what's being done to make sure that our data, this medical data, is handled ethically and responsibly?
Well, training and education never stops. They got to stay up to date on privacy regulations, security best practices, the ethical considerations, all of it. Organizations like Canada Health Infoway, they're doing really important work developing those standards and guidelines, making sure everybody's using best practices across the entire healthcare system.
That is really good to hear because it sounds like the goal isn't just, to digitize healthcare for the sake of it. It's about doing it right, putting the patient first, making sure their privacy and their data are protected.
Exactly. It's about using technology to improve healthcare for everyone. But we have to keep our most sensitive information safe.
Well said. This has been a really, really fascinating deep dive. I feel like I've learned so much about EMR and EHR and the incredible work that these analysts do every day.
It's been my pleasure, really. It's such a cool field to be a part of because it's changing all the time. Always something new to learn.
Absolutely. Well, that's it for today's deep dive into the world of data and technology. Big thanks to you for listening. And hey, next time you're at the doctor's office, take a moment to think about those EHR analysts working behind the scenes. They're the ones making sure your medical information is accurate, safe, and sound. Until next time, stay curious, everybody.